But sometimes, especially in kids, we do not perform osteosynthesis because the bone healing is a rapid process, more rapid process than in grow people. Sometimes we use bone grafts and do transplantation of the bony tissue. The best bone graft is autologous bone graft, which was taken from the same patient. It heals well, it heals rapidly, and it works for bony substitution, for substitution of bony defects. Those bony defects could be natural, then they could be from open wedge osteotomy. They could be as a result of bone resection in some tumor cases. That's why when we have bony defect, no matter what is the reason of this defect, we have to replace this defect with bony bone graft. As I said, the best bone graft is autologous bone graft, but the best of autologous bone graft is well vascularized bone graft. The vascularized bone graft could be taken from surroundings first, and then they could be reached to the reception site, to the defect distantly by dividing the vessels and muscle tissue around the bone. Then when we place the vascularized bone graft to the defect site, we have to suture those nourishing vessels. After that, we could expect the bony healing like in fracture without the process of creeping substitution. That's why these techniques, those techniques are very valuable and very interesting and very successful in reconstructive surgery, vascularized bone grafts. Replantation is actually operation which is for traumatology, but bony resection we do when there is an infection of some endpoint parts of the bone, when there is a tumor cases, sometimes benign and sometimes malignant bony tumors could be resected or should be resected. Then it comes operations around the joints. Arthrodesis is a procedure which fuse the joints. In our specialty, we have to restore the movements, we have to restore the length, we have to restore the form, but sometimes we do arthrodesis. It's strange, but happens. Arthrodesis will completely restrict movements in certain joints. It will eliminate the movements, but it will eliminate the pain together with movement. And in special cases, in special patients, the arthrodesis is very valuable and very successful operation. That's why sometimes we lose something like movements, but we reach painless walking or painless function of the limb. That's why we relay on arthrodesis sometimes. Amputations are performed when there is no other way of treatment. Amputations could be done in curing of tumor process, especially in malignant tumors. Amputations could be performed in case of severe infections. I have one patient in the third floor now. I think I told you about him. He has 2 knee joint infected and several diseases together with this, and we do amputate his left femur because of uncurable infection and worsening of general condition. That's why amputations helps to treat the life-treating operations sometimes, and help to lengthen the life of the patient. And after the amputations, usually it comes time for prosthesis, external prosthesis, but not as soon as 3 months after the operation. Diabetic patients also are common patient for arthrodesis when there is a combination between vascular problem and infection. This is potentially a case for amputation. Diabetic patient, diabetic foot is treated by amputation mostly. This is an example of a vascularized bone graft. A special technique, fibula protibia. In this hem, you can see that there is a bony defect, probably because of non-union after traumatic case or something like that, or major bone, tibia bone. But the fibula is well vascularized normally. Then this bony defect could be breached by a vascular bone graft fibula. Fibula could be bent in 2 parts. Fibula could be resect in upper part or fold in the lower part of the tibia. There are several possibilities for doing vascularized bone graft by fibula transplantation. In our case, which was done many years ago, this was one young man which was traumatized in car crash accident. Actually, he was driver of motorcycle, and this motorcycle was hit by a car. After the first post-traumatic period, he has no he was missing a big part of the tibia. That's why we decided to put on the site of defect segment from fibula. And after a long period of healing, several months or years, I think, I'm not sure, 95, 96, this is 1 year after that, there is a bony healing in both sides of the fibula vascularized graft, and this is not the all. As you can see, there is a hypertrophy of the fibula, which transfers the mechanical stress, and this will lead to hypertrophy of the graft. It's a significant result. This is a very good result. And this guy was able to walk without any support, without crutches. This reconstruction. Okay, other cases which were indicated for bony resection. Bony resection is done both in benign bone tumors or malignant bone tumors. This is example of one case of multiple exostosis. This is benign bone tumor, which is presented with exostosis, osteocartilaginous exostosis around the joints. As you can see, here is one, here is another, here is another. And this is not the only presentation. There are several exostoses on opposite limb, on the upper limb also. And we do not resect this exostosis because it was painless, but we resect this one because it was complicated with hematome, big hematome around the knee because of the friction between this exostosis and fascia lata. That's why we resect only this, which was symptomatic, painful, or compress. If this exostosis compress some vascular bundle, vascular neural bundle, it should be resected. Usually there is no relapse of the disease. What is resected never grow up again. This is also one exostosis in the same patient, but it was quiet without symptoms. That's why we leave it like this, and the patient was discharged. Actually, this patient was a doctor, our colleague, woman, which has a lot of exostosis or chondromas in her body. Another clinical case example for the need of amputation. This patient suffers from diabetes, and also there was a severe infection of her great toe. As you can see, there is a bone soft tissue defect. The tendon was visible. The nail was destroyed from infection. And after a long period of dressing and minor surgical debridement, there is a infection, uncurable infection. That's why it comes time for amputation. And I think this is the final slide for today. One disappointing case of our practice. This is the limb with one well-developed malignant bone tumor, which was treated for several years with several operations, but in final 2 or 3 years, the mother of this woman, she was, I think, 21. If I write, the mother decided not to rely on doctors, just rely on natural medicine, and she started to give her daughter some teas, some fungis, some other treatment which doesn't help, obviously. And when we admit the patient, we saw that there is a huge growth of the tumor, and together with this, significant impaired of general health. The patient was with hemoglobin close to 60, and we need to perform a rapid amputation and then additional treatment of this patient. This is a very disappointed case. And 9 or 10 months after that, the patient died because of metastasis. And this was also very disappointed our treatment, but sometimes it happens. We are not God. We are just the doctors. We can treat the patient if the patient rely on our experience, on our knowledge, on our practice, but sometimes we do not succeed to help significantly. Okay, if you have some questions about general treatment rules, principles in orthopedics, I'm here to answer you. It's better to stop on a successful case, not in a such like previous one. Okay. I'm planning to give you 2 lectures in next Monday. It will be 7th of December, I think. Is that okay for you?